I'm Mike Ruppel. I'm the Executive Director of the AIDS Institute, and thank you for choosing our institute today, which I think is very timely based on the opening plenary. And I just have a couple words before we get started, because we have an action-packed agenda, and I really hope that you join us for the after-lunch session, that you come back and feel re-energized. But I do want to point out one of our speakers today that we talked about this morning at this morning's plenary, which is Jeff Crowley. And we're very lucky to have him today. And as the architect of the National HIV and AIDS Strategy, I think it's important that he participates, and the AIDS Institute would like to dedicate this session to him today.
I do just want to thank the AIDS Institute for holding this session and really focusing on this really in the long term on these testing issues. You know, we have for a long time believed that expanded HIV testing is important. You know, one of the first things we did was we commissioned the Institute of Medicine to look at some of these issues and really say, okay, how can we operationalize some of the issues that we need to implement to expand access to testing. You know, I think the CDC's new approach to high impact prevention, where testing is really a part of it. One of the things I would note though is that sometimes I've gotten this question, people say to me, and I think we're talking to both sides of our mouths. It's like, are we trying to routinize testing or are we trying to target testing? And I would say yes, we're trying to do both. And I don't think they're inconsistent. I mean, I think that we can hopefully all agree that we are trying to routinize HIV screening for people in clinical care. So if you go in, your provider shouldn't be doing all these assessments, they should just be screening you for HIV. But a big focus with public health dollars, they're very limited, and it's not, I mean, I love the goal of a testing goal. And, Dr. Coburn pushed that in the Ryan White reauthorization, and we agree with him. It's important to expand access to testing, but it's not really the number of tests performed, it's the number of positives. And so I think that CDC's efforts, their expanded testing initiative, really are. I mean, and they're getting data to show that it's the right approach. That it's really a strategy to really identify more people living with HIV. So I just, since I had the chance to speak, didn't want to leave this unanswered, because people, we are trying to routinize testing, and we are trying to get smart about using our public health resources to have a bigger impact. So. I won't say too much more. I think there's a lot of work that needs to be done, but some of it is starting to happen. I know Dr. Forsythe mentioned some of the federal things. I don't know if it was mentioned that, we're hopeful that the U.S. Preventive Services Task Force will take a fresh look at the data. The Presidential Advisory Council on HIV/AIDS passed a resolution asking them to take this issue up. Those are the kinds of steps that we need to be thinking about as we go forward. But with that, I'll stop. But it's exciting to see so many of you people here engaged on this issue, and thanks for what you're doing.